So it's quite rational to use both image modality for this patient evaluations. So in PET imaging, we will use a scoring system called primary scoring system. So just like the concept of PIRAIS, the higher score indicating the higher cancer risk. So when we find a focal pattern and increase its PSMA uptake, the cancer risk is increased. So when we do a ROC analysis, as you can see, the focal pattern and the increase SUV PSMA uptake, the increase the cancer risk, the prostate cancer risk. And when we compare this scoring system with PIRAIS, this system shows slightly better as compared to the PIRAIS score system. So right now we are conducting a prospective PSMA PET study on prostate biopsy naive patients. So I'm going to show some preliminary results. So right now we enrolled 26 patients. All of them are biopsy naive, and the mean age is around 60 years old. And in the end, 10 patients going to the biopsy and have a pathology correlation. 7 patients do the MRI guide biopsy, and 3 patients do a random biopsy. And it turned out to be have 2 patients have biopsy positive results. So when we do a patient-based analysis, we correlate with primary score system with MRI PIRAIS scoring system. There's a moderate correlation with these 2 systems. When we focus on the lesion-based analysis, we can find 3 kinds of lesion, which is the component lesion, both PSMA positive and MRI positive, and negative PSMA lesions, no PSMA uptake in the MRI suspicious lesion, and negative MRI lesion, which is PSMA additive without MRI correlate. So we can find these 3 kinds of lesion. So in the end, 72 lesions are found in our patient cohort. And we found out that almost 80% of lesions turned to be discordant. So this is not uncommon. So going to a clinical implication, I think that the most distinct factor differentiating subsequent biopsy positive from biopsy negative case are the presence of PET MRI concordant lesion with PIRAIS 4 to 5. So when there's a MRI PIRAIS 4 to 5 lesion, and also it shows increased PSMA PET uptake, usually we have probably we can have a confidence to say it could be a potential cancer lesion. So this is the case. As you can see, on the MRI there's a focal lesion on the right, posterior peripheral zone turned out to be PIRAIS 4, and also we have PSMA uptake, primary score false. So we do a MRI focused biopsy, it turned out to be a 3+3 lesion. But since this is a preliminary results, from our finding, we can say that the primary score alone still may not be sufficient. Still may be insufficient for prostate cancer risk stratification. And in this cohort, we found out that discordance, the PSMA PET and MRI discordant lesion are not uncommon. So for clinical application, we can integrate PET MRI concordance with PIRAIS, especially PIRAIS scores concordant lesion may improve the prediction